Hey everybody, Jamie King here. Yes, that Jamie King from the Jamie King webcast, the one and only. Thank you for tuning in. For my first video, I just wanted to make this quick clip here to let you know that the interview got cut short. I'm not sure what happened. The video stopped before we were done, so we missed some of it, probably a good 10 or 15 minutes. I'm not sure what happened other than I'm new and I'm not a professional. I was using an app for the first time to record the video. I'm not a professional. I don't know what happened. So my sincere apologies to Miss Sandra Wearins for that. And I can say that we still got a lot of really good content. She had humble beginnings and she went on to get her master's degree and work with some of the top HIV doctors in the country, among all kinds of other stories that you're just not going to want to miss. So tune in, watch the whole thing, like, comment, share, subscribe, and I will see you on the next one. Hi, welcome to the Jamie King webcast. We're here today. We're going to be talking to Sandra Wearins. She's an amazing woman. I think she's had an incredible life, and we're here to talk about it. We're going to find out what happened. So if you like this content, if you want to see more of it, don't forget to like, share, comment, subscribe, all the things that they all tell you to do. We're all about it. So Sandra, thank you for joining me today.
Oh, I loved.
So tell me a little bit about yourself. Where are you from?
I'm originally from Pembroke, North Carolina.
You were born in Pembroke?
Yes.
Okay. You have a happy childhood?
Medium happy.
Medium happy?
Yes.
Do you have any siblings?
One sister and two brothers.
Were they older or younger than you?
Older.
So you were the youngest of four?
Yes.
Are they still living?
My oldest brother passed away. My second oldest brother is, if I'm 68, he's almost 80. And my sister is 72.
Okay. So I see you wearing the Lumbee Indian shirt.
Yes.
Tell me a little bit about that.
Well, the Lumbee is a tribe that lives in North Carolina, and there's probably about 68,000 of us.
Wow, okay.
Yes, we just got federal recognition. It's taken a very, very long time. We got $900 million.
Wow.
Yes.
How was that distributed? Do you know?
Not quite. I'm not real clear on it. People want to open up a casino.
So was it for programs or
It's
health
for
or
programs, education. We now have what's considered a reservation, but it's only about 4 different counties, like Robertson County. I want to say, wow, I can't remember all the counties. I'm sorry.
That's okay.
But some people, we have a tribal council. Some people want a casino to bring in money. There's a lot of Christians. They don't want a casino. They think it will just increase, the alcoholism. We do have a lot of alcoholism. They want, daycare. They want senior living, senior housing.
Right.
So everybody wants something different. So living in Florida, I am part of the tribe. You have to get your tribal recognition. Everybody has to vote on what they think should be best. So I'm not really up to date on what's happening.
Right.
Yeah.
So both of your parents were Lumbee Indians? You're full-blooded 100% Lumbee?
Well, for the time being, we'll say yes.
Okay.
Okay. Well, if you look at my parents, some Lumbees say that we haven't always been Lumbees. Some Lumbees wanted to be Cherokee. Some Lumbees say they were Croatan. Some Lumbees could look part Caucasian.
So would you say that they were Lumbee, but they identified as other tribes?
Yes, let's say that.
Okay.
Mm-hmm.
Interesting.
Yes, it is interesting. And it's still going on. It's been going on since around the late 1800s. Yeah, you could say some Lumbees look like they could be mixed with African American. You could say some Lumbees look like they could be mixed with Caucasian.
Okay.
Mm-hmm.
Did you enjoy school?
In North Carolina, yes. I enjoyed school in Baltimore, but I had never been to school with anyone but other Lumbees until we moved to Baltimore. So
How old were you when you moved to Baltimore?
9.
Okay.
Yes. When we moved here, most of the people in the community I lived in were Lumbee. So it was almost like having our own little reservation.
Okay.
But I was going to school with, at the time we called them hillbillies. And we were going to school with African Americans. So it was really totally different.
Okay.
Yeah.
You were going to school with hillbillies in North Carolina, and then you moved to...
No, we was going to school with hillbillies in Baltimore.
Okay.
Yeah, because they came from West Virginia.
Oh, okay.
Yeah, so they were called hillbillies.
Okay.
And going to school with African Americans. And in North Carolina, you went to school with other Indian kids.
Oh,
that was it. You just didn't, as someone called it, the races didn't mingle.
Oh, okay.
Yeah.
I'm from Arkansas. I'm familiar with the concept.
Oh, okay. Yeah.
Okay. So, how many children do you have?
Well, right now I have 3 daughters. At one point, I had 3 daughters and a son.
Okay. And the son's not with us anymore?
No. My son, Aaron, is dead.
So, you want to talk a little bit about becoming a mother?
I was a mother at 14.
That had been rough.
Yeah, it was, because no one in my family talked about sex.
Right.
And I was in 9th grade. Well, the way I met my ex-husband was I was sitting on the fire escape and I saw this tall, handsome Indian guy walking up the street to this bar called the Volcano, which was where all Indian men and women went to.
Okay.
And he looked like a model. He had on these orange, like suede pants and this multicolored orange shirt. And I just fell in love. And we were moving, and he helped us move. And I never told him how old I was because I looked older than my age.
And you were how old?
14.
How old was he?
19.
Okay.
And I'm not sure how it happened, but we started having sex because he lived in an apartment with some other bricklayers. He was a bricklayer. And I got pregnant.
And then you married him?
Well, I married him after I had Michelle.
Okay, your oldest?
Mm-hmm.
Okay.
And I thought I was going to have her when I was 15, but I actually had her when I was 14. She was premature. She was born a 7-month baby.
Oh, my goodness.
4 pounds and 7 ounces. And we got married. And 2 years later, I had Felicia. And then they were born 72, 74, 82, 84.
Wow, okay.
It was a horrible marriage.
Well,
I should have never. I always thought that inside of him was a prince, and that if I just loved him enough, that this prince was, yes, but the same thing that was on the outside was on the inside. He didn't love me.
So you had 4 children together?
We had 4 children together.
And did you work during the marriage?
Off and on, I worked. And for a long time, I was on welfare, food stamps, check,
right,
medical assistance. We lived in an apartment, and everyone knew everyone's business. And I would sit on the steps, these concrete steps, and I used to watch these cars going down Baltimore Street, and there would be these women in them, and they would be, dressed and going to work. And I always thought, that's what I want. I want to be dressed up, going to a job. And
that was during your marriage, or?
I was during my marriage, yes.
But you were still pretty young.
Yeah, I was still pretty young.
So how did having a baby affect your schooling? Did you have to drop out?
I had to drop out of school. I dropped out in the 9th grade.
Okay.
And I had we used to look forward to getting the check at the first of the month.
Right.
Because we would get the bus and go to the McDonald's. And that was our, big party thing.
Right.
And but I wanted a job. I wanted to do something with my life. I didn't want my kids to grow up on welfare. I wanted them to grow up and go to school and go to college and get good jobs. And
it's very admirable.
Yes.
I respect that.
Yes. And so the marriage was really bad. It was a very violent marriage.
So how long did the marriage last? How long were you married the first time?
Off and on.
Well, did you get divorced and then get remarried?
Not to him. No.
Okay.
I called his mother one day.
So you're saying that you separated multiple times?
And multiple times. He was in prison off and on. He was with other women. So I just called his mother one day, and she came and got him. And I didn't see him again for probably till my son was about. No, I didn't even see him then. I think the first time I saw him again was when my mother passed away. I went down for that. My mother was in a nursing home, and I went down for that.
So you remember how long you were married total? Like from getting pregnant and married to divorce?
Maybe 15 years.
Okay.
Yeah, about that long. If it was that long, I really don't remember. I try to block that time out of my life.
I don't blame you.
Yeah, it was.
So there you were living in Baltimore, a single mother of 4.
Mm-hmm.
And what were you doing at the time?
As I said, I was on and off welfare. I did get a job. I got one job at the up the street grocery store where I would, sell food, cut bologna, and foretell dreams. People would have dreams, and they would stop in to tell me their dreams, and I would try to,
Is that something you learned through your
I learned it through my
heritage?
Through my grandmother. She was a medicine woman.
Oh, okay.
Yes, and she would, help people get frogs out of their legs, and she would, help them stay out of prison.
How would she? First of all, they had frogs in their legs?
Well, that's what they said. So they would come, and there was a marshy land behind her house, and she would tell them how many times to go out there and walk around, and the frogs would jump out, and their legs would go down. So that would happen. She would have a mixture of salt and other things, and if you went to court and you were going to go to prison, she would tell you how many times to throw it over your shoulder. to keep you from going to prison. She would foretell dreams also.
Okay.
So I grew up with that. So I learned how to tell dreams.
So after the cutting the bologna, did you do anything else after that? Like have other jobs?
Yes, I worked at the library, in a Pratt library.
In Baltimore?
Yes, in Baltimore. I worked in stacks and shelves when people would come to get books. We would get them off the shelves downstairs, put them in a little like cart, not a cart. We would pull it and send it upstairs. I worked at my Indian Center. I worked at the um, I have problems with short-term memory loss, so I really can't. Uh, the YWC, the YWCA, I
Okay.
worked there. Uh, wow. I worked at okay, best job. I was working at my Indian Center, and a woman from the Baltimore City Health Department came in, and she said there was a job at the Baltimore City Health Department, and it was trying to help women who were, at that time, they called them prostitutes,
Okay.
or they were working for pimps, and they wanted to get them tested for HIV. And there was a van, it was called Ujima, and you would go out from 11 at night till 3 in the morning to help these women get tested.
Okay.
And would I be willing to get the training to work on this van? And I said, Brenda, I can't, I'm not smart enough to do this. I can't do this job. And she goes, Sandra, yes, you can. You can really do this job. And I took the job.
And this was with the city of Baltimore?
Yep.
How old were you then?
Maybe 20, 19, 20, 21. And I took the job, and I was great at it. And I loved it. And a lot of the people I knew, some of them I didn't. It's hard to tell someone you know that they have HIV.
I can imagine it's hard to tell anybody, but especially somebody you know.
You know. One of the young women, I knew her, and I knew her boyfriend because I grew up with him. And she didn't want to get the test. She didn't want to talk to me because she had to make some money to take back home. So I gave her some money, and I said, you take the money, you can pretend you work for it, and let's get the test. And she got the test. She was positive, but she was very sick. 2 or 3 months later, she died. And that was very hard. And the person that, was supposed to be her boyfriend, I remember I had stopped at his mother's house, and she had asked me about him, and she told me what was going on with him physically. And I didn't say anything, but I remember he thought I had told his mother, and I was driving down the street, and he started screaming and chasing my car. And I had an old car, and I was so scared it was going to break down. I'm thinking, oh, please don't because he's probably going to beat me up.
So because he thought you told his mom?
Yes, he thought I told.
Were there many people that you knew that you had to tell that they had HIV?
Not so many from the community, but when you go out so many times a night in a certain neighborhood, you get to know people.
So you had instances where you tested people that were negative, and then you went back and you tested them
again,
later,
they were positive. One person I had to tell, I thought he lived upstairs. He lived upstairs from my brother, and I thought he actually lived there because I kept seeing him, and I knew his girlfriend. But I went to another area of the city called North Baltimore, and he came on the van, and he got tested, and he was positive. I didn't know he was married and lived in North Baltimore.
Right.
And having to tell him. And then he just started telling me his life story and, where he worked, how long he'd worked there, how many years he'd been married. And I just kept saying, I'm sorry, I'm sorry, I'm sorry.
So what years was this was HIV still fairly new at that time?
It was not new. It wasn't like it was in the 90s and the early 2000s. And,
Okay.
and that time there was medication, but it was still prevalent, because I did health fairs and I did gay pride and I took my kids to gay pride. And um, I remember I had a father, a son, and a grandfather. They were all infected.
Wow.
And they all moved in together. I remember I had a couple, and they had said, if they both tested positive, they were going to move in together and help each other. And I'm thinking, all right. And when he tested positive, he just broke out in a sweat. And he said, I'm going to have to get off this fan. And I said, okay. And she said, I don't think I can stay with him. I said, it's okay, I understand.
That had to have been an emotionally taxing job.
Very much so. It really was. And I remember, and I don't know why, something had happened, and I stuck my hand in the red box, and I got stuck. And I remember, and I worked with EMTs, firemen. And I went back to the office the next day, and I had to get all these shots, and I had to get these tests, and I really knew how people felt.
Right.
That fear,
Right.
that waiting. And I remember calling someone in San Francisco who was there from the early days, and because they wanted to give me medication. And he said, Sandra, don't take that medication, because if you're infected, it's not going to change anything, but that medication is going to make you sick. So
how long did it take you to find out for sure that you didn't get it?
About 2 weeks.
No, that had to have been pretty excruciating.
Yes, it was frightening.
So how long did you do that job?
Oh, about 3 years. Mm-hmm. I remember we were in this area, and this young boy, he was dealing drugs, trying to help his mother. His mother was using, and he was sitting on the steps in West Baltimore near this grocery store, this little corner store. And this guy comes up, and he picks him up and just takes him, busts his head in the cement. And I'm saying to the guys on the van, go out there and get him, go out there and get him. And they're saying, Sandra. And I'm like, please, just go out there and get him. He could die, just bring him on the van. And they did. So they call the ambulance comes, gets him, takes him to the hospital. So the next night we're back in that area, and I get off the van. I'm going to go in the store, and get me like some junk food, a soda. And this guy, he's standing there in the doorway, and he pulls out this gun, this pistol, and he says, if you ever put your nose in my business again, I will kill you. Do you understand me?
So who was this guy? Did you ever know?
He was the dealer that the boy was working for. And I go, yeah, I know. And I was just trembling.
How old was the boy?
About 17, 18. And I just got back on the van, and one of the workers, Joe, he goes, Sandra, what happened? And I told him. He says, what do you want? I said, nothing. I'm just gonna, sit here and just. So I remember having this woman come on. She was turning tricks, and she told me she had this guy that she I turned tricks with, and he didn't have any. His legs stopped at the knees. And then when they would have sex, he would flap up against her legs like a fish. And I was just, I can't believe the stories these people are telling me. So, it was some funny things. It was some horrible things. It was.
How many nights a week did you go out?
I went out Friday night, Saturday night, Sunday night.
And that was your whole job, was those 3 days during the week?
And then Tuesdays, I would go into the office because I had to do my reports and, those type things. But yeah. Mm-hmm. And it was, it was bad sometimes, but I remember I had this young boy and I had to take his mother to the hospital, and she died in the hospital. And he was 16. He's in high school. And he asked me, I saw him, and he said, he's crying. He was like, what happened to my mother? But due to HIPAA, I couldn't tell him,
How old was the boy?
He was 16.
Oh, he was 16.
Yes, he was 16. He was in high school. And I told him he needed to go talk to his grandparents.
Right.
Yeah, but that was just so painful. Just,
Now, you mentioned Brenda before. She was the one that came into the library and recruited you.
Yes.
So did you work with Brenda while you were in that job?
Sometimes, but she was really my boss.
She's your boss?
Yeah, but she's been my friend for over 35 years.
Oh, is that right? So she must have been a good boss.
Oh, she was excellent. Because of her, I went to graduate school.
Really?
Yes. I got my master's.
So you dropped out of school in 9th grade and you went back and got your master's degree?
Because of my life experience, and I got my GED.
Okay.
Yes. So I was able to go to a school in Pennsylvania and get my master's degree in human services.
And Brenda was instrumental in making that happen.
Yes.
Well, that's awesome.
Because she said, Sandra, you could get your master's degree based on all this work that you've done, the experience that you have. And I was like, Pridge, I'm 39. I would be 41. She said, well, you can be 41 with it or 41 without it.
That's a fact.
So I did it. Then I went to work for the State of Maryland Health Department. I did that for a couple years.
What did you do with them?
I did HIV, same kind of thing, only more programs.
So you moved up. You started with the city of Baltimore, got your master's, then moved up to the state level.
You moved up to the state level. Then after that, I moved to the Institute of Human Virology, where I worked with doctors Robert Gallo, who helped to invent the test for HIV.
Wow, okay.
Dr. Robert Redfield, Dr. Bill Blattner, Dr. Charlie Davis. And what we were doing, we were trying to invent, give me a second, we were trying to invent a vaccine for HIV.
Okay.
And I was the director of that program.
Wow.
So
you really moved up.
Yeah, that money got really good. But I love the work because, excuse me, I like going out telling and talking to people about HIV that was no longer a death sentence.
Right.
And that we were looking for a vaccine. But I talked to communities of color.
Okay.
Because communities of color, they believe we were trying to kill them, that we were trying to give them HIV because we wanted them to die.
Now, is that based on history? Because I know there has been cases of syphilis being
and what happened?
Intentionally infecting the Black community.
Well, infecting in men And when there was a cure, the Centers for Disease Control said, let's see what's going to happen. So we're not going to let them know, and we're going to watch what happened. So what happened was the husbands infected the wives were infected, the children were born infected. And what did they do? They watched the life of syphilis.
So that's why they distrusted.
One of many reasons. So I decided, well, I can't ask people and explain something that I'm not willing to do. So I got the vaccine. But people didn't understand the difference between the vaccine and the virus. So they thought that I had gotten HIV.
They thought that you were injected with the virus to build your immunity to it.
Mm-hmm. So when people would see me, they did an article in a magazine, they wrote me up in the paper. So when people would see me, they would be like, oh, thank God, Sandra, Miss Wearins, thank you. And I'm trying to say, no, I don't have HIV. It's a vaccine. We're trying to invent a vaccine to stop people from getting infected. And it took a long time. But when I first got the vaccine now, I was on my way to work and this like pain washed over my stomach so bad. I got scared and I called my boss, Dr. Blattner. He was at the beach and he goes, oh, Sandra, great immune response. You're doing great. So, no, I didn't have HIV, right, but the vaccine, yes. And, but one thing that would happen was when people would come to sign up for the vaccine, because I think they would get like $25 or $30. I always knew when they were positive because I would look at them and I would say, you already know this, right? And they would go like, and I had a friend who was running a support group for people who had HIV.
Right.
And I would tell him, go over and see, this person and he'll get you into his group. And then, Big Pharma would come and they would talk about the new medications, take people out to Ruth Chris Steakhouse and feed us and that kind of stuff. We'll feed them, but they would take me too. And so I really liked that job. I didn't like working for Dr. Gallo because he would do things like, he was very arrogant. When they developed the test for HIV, and they were at NIH, him and 5 other doctors, and they got $1 million a year for 5 years for developing that vaccine. And they had all their pictures on the wall. So I remember once he wrote this paper for a journal, and he came downstairs and he goes, oh, I wanted someone to read this paper who would really understand it. So thought I would bring it down to a woman. Do you want to read this? I go, nah, take it to somebody else. I'm not reading it.
He wanted somebody to read it he didn't think would understand it?
Yeah. Mm-hmm. So he brought it to a woman. Yeah.
What years was this roughly?
This was late 90s, 2000s, I think. Wait, 2015 I got sick. Yeah, early 2000s, somewhere around there. I'm trying to remember correctly. But he used to have a party at his house every year, and it was the pool and
this is the Dr. Gallo, right?
Yeah, and the tennis and all that stuff. And he would always invite us to go, but I would never go. And
because you didn't like him personally?
No, because I didn't like him personally. And so then I went to work at NIH, and I was outside smoking one day, and I saw him and his wife. So I was racing to get to the elevator, uh, but because I didn't want to have to talk to him, but they made it. And he goes, "Huh, didn't dress like that when you worked for me." And I said, "Well, they pay me more money than you did." And then his wife goes, "We're getting ready to have our party." And I said, "Oh, I can't come." And she goes, "Really? Are you just saying that?" And I go, "No." I said, "My mom's sick. I'm going to have to go to North Carolina to see her." She goes, "Oh, you never can." I go, "Oh, I'm so sorry."
Mm.
But I thought, I'm not going to that party. No. So in Redfield, he wound up working at the CDC during Trump's first term. And I saw him on TV, and he just looked so beat down. Because I remember once um, he said, "You can call me," because I said, "Hey, Bob, how you doing?" And he goes, "You can call me Redfield or Dr. Redfield, but you can't call me Bob."
One of those.
Yeah, one of those. So, but when I saw him standing behind Trump, he looked like he had shrunk. His face, he looked like he had become an alcoholic. His face was all red. He was wringing his hands. He looked so beat. Well, they fired him, so I don't know what happened to him. But Dr. Gallo is now in Florida, where I live, working at the hospital I'm going to.
Really?
Yes, running the Cancer Institute
Small
down there.
world.
Small world. Yes, it is.
Now you
So,
mentioned getting sick.
oh,
That was 2015, you said?
2015. Yes.
What happened?
Well, in March, first of all, I started getting lost. I was still at NIH, but I started. One morning I went outside. I think it was in March or April. I was living here in Hagerstown. And I went outside, and it's that springtime. So I took this big breath of fresh air, but I didn't smell anything. I thought, well, that's weird. So then I thought, well, I should at least smell like motor oil or tires or something. I did it again and I didn't smell anything. And then I felt like I had this like big wad of cotton across the top of my head. And so I can't smell. I'm getting lost. I can't remember people's names. And so I go to see my doctor, and I said to her, and I had been looking on the Cancer Institute, website, and I'm thinking, I think I have a brain tumor. So I go to see my doctor, and I said to her, I think I have a brain tumor. And she goes, why? I said, and I gave her my symptoms, and she says, you don't have a brain tumor. You have sinusitis. I said, no, I don't think I have sinusitis. So, we go on with this. We're going back and forth and back and forth. And so this is March, April, May. I go to the library here in Hagerstown, and it's only across the bridge from where I live. It took me 30 minutes to get my way back home because I got lost. So I think it's maybe June, July, August. I said to her, well, if you say I have sinusitis, I want to see an ENT. So she finally makes me the appointment. I see the ENT, and you would think he was doing a clinical trial. He says, well, let's try this. And it was medication. That didn't work. Let's try this. So we tried. I said, are we doing a clinical trial? Because that's how I feel. No. I said, but why don't we just do an MRI?
How many medicines did they try?
3.
To treat your sinuses?
Yeah. And he did a CAT scan.
Okay.
Yeah. And he said, something with my nostrils. It was like It sounded like I had sinusitis. I said, well, let's just do the MRI. So this was on October 5th. So he says, if I don't call you, everything's fine. I go, no. If you don't call me, I'll call you. No, I'm not waiting for you. Well, October 6th was my birthday, and I was turning 56, 58, one or the other. But I had it all planned out, what I was going to do. I was going to have a great time. So the phone rings, and it's him. And he said, and I could tell by his voice, and he says, Miss Wearins, and I go, yes. He says, you have a meningioma, and you have a brain tumor, and you need to see a neurosurgeon as soon as possible. And I know one.
Wow.
And so I think it was like a week later, 10 days later, I go see this neurosurgeon, Dr. Holmes. So he told me I had a brain tumor the size of a small apple or a large orange.
Wow.
And I'd had it 10 to 15 years. It was slow growing. And he did what I call the drunk test, touch your nose.
Right.
Well, first he said to me, do you know my name? And I said, well, first I thought it was Jones, but I heard someone say Holmes. So, and I had Felicia with me. And so we did the test. He had looked at the MRI. And I think October 22nd, I had the surgery.
Wow, it was fast.
Yeah. And it was attached to, I think, the third, 1, 2, 3, brain barrier.
Okay.
And they took a piece of meat out of my thigh because they had to cut it off, that piece of my blood-brain barrier. So they needed to sew something back there. Let's see.
So you had a tumor for
10 to
up
15.
to 10 to 15 years.
Yeah, he said.
Did you have any symptoms up before the loss of smell?
I would have slight headaches every now and again, but nothing really, really serious.
And you were working at NIH at the time?
Yeah, I had to quit my job. Yeah. I was making really good money too. I love my work.
Right.
We were working on this project called PROMISE, Patient Reported Outcomes Information System. And it had to do with arthritis. That's how it first started. Like when you go and you get a test and you have to go, they ask you one question, then they ask you another question, then they ask you. Well, PROMISE allowed the first question would lead to the next question, would lead to the next question, would lead to the next question. They didn't have to ask you like 50 questions.
Okay.
And we had different universities that were part of it. I mean, these really smart universities. And so I was working with these, doctors at NIH who work with arthritis. And then we had these university doctors who we were working with. Some of them were PhDs, but quite a few of them were MDs from hospitals. So I, except for the doctor that I was working under, I liked everybody else.
So you haven't worked since you had your brain tumor removed?
No. Have I? No, I don't think so. I worked after I left in. Wait a minute. Now I'm trying to get this right. No, I don't think I've worked since I've had it removed. I worked while I was ill, but I think once I had it removed, I went on disability.
Okay.
Yeah, that's what happened. But Okay, let me see if I can get this right. I found out I had it. Maybe I left NIH while I was still sick, while it was still growing.
Before you knew you had it.
Before I knew I had it, yeah, because I knew something was wrong because I couldn't smell